All right, let's talk about these reverse lunges. Now, obviously, knee pain can be really worrying, but the good news is, from what you've told me, this sounds like more of a movement pattern issue than an acute injury. If it was happening just on one side, then I might be worried about like a strain or something meniscus, but because it's happening on both sides, that tells me it's probably more of a movement pattern issue, and that is something that we can start to solve straight away, and this is gonna be really good for you. So what is likely happening, the reason you're getting pain in your back knee when you're doing these reverse lunges is because you're putting too much weight into the back leg. So with any lunge, the front leg is always the star of the show. If I was to step forward into a lunge here, this leg is the working leg, that leg is just for balance. If I was to step back, this leg now becomes the supporting leg. This is the working leg. So whatever leg is in front is the one that should be taking about 90% of the weight. And the other leg is just there as a bit of a kickstand. Like when you kickstand your bike, it doesn't fall over. That's what we're going for. So you've got one really hard working limb, and then the other one is just like there to make sure that you don't ass over. So making sure first and foremost that you have the weight in the right leg is going to be key. That is also going to help you to stop putting as much pressure through the back knee. So what likely happens when you get pain in the back knee during a lunge is that when you step back, right, you're putting too much weight into this leg, but also if your torso is too upright, you're going into extension in this hip. So we're getting this big stretch through the quads, through the hip flexors, and that's putting a lot of downward pressure on the knee. So the first thing is we want to put more work into this leg. How do we do that? Start to lean forward a little bit. Okay, so you'll notice when you're upright like this, that puts that leg into a lot of extension. And some people tend to overextend, especially if you've got weight on your back, like a barbell reverse lunge. So this could have been happening for you, is that you're trying not to fall forward with this weight, and it's meaning that you're actually hyperextending or just going into that extension, and that's putting way too much downward pressure on that back knee. What we want to think about doing is just slightly leaning forward with that weight, and then that knee, that front knee, is going to travel forward a little bit, okay? This is my really stiff ankle, but you can see it here. If I was to lunge here, I'm going to go forward, this knee is coming forward, this leg is nowhere near extension. See the difference between this position and this position? Yeah, so those two little tweaks of one, putting more work into the front leg, and two, leaning forward slightly with the torso can make a huge difference. It's going to take all that pressure off of the back knee. It is normal, like I'd said, with a reverse lunge, like with a barbell on your back, to want to tip forward. So what we'll do is we can switch those out for like a goblet or even a body weight squat at the moment, just to relearn that movement pattern. But at home, give this a go, where your front leg is the one that's doing all the work, you're slightly leaning forward, and then you're coming down, feeling that stretch through the glute, using this leg to stand back up. So here, and up. Give that a go on both sides. See how it feels. You don't win any awards for like the biggest step back or the most steps, so just go to where it feels comfortable. But those two tweaks should make a big difference, and I'm very keen to see how they